Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Mr. Hamza. May I know what brings you here today? Okay. Tell me more. I'm really sorry to hear about that, Mr. Hamza, and I understand that how painful and difficult situation would be for you. But to better understand your condition, I need to ask you a few questions. Is it okay with you? And thanks for your cooperation, Mr. Hamza. So, can you tell me since how long you are suffering from this? Okay. And how many stools do you have to pass per week? If your stools are hard or soft? May I know the consistency of your stool, Mr. Hamza? Have you noticed any straining while passing a stool? Any feeling of incomplete evacuation after passing school? Okay. And Mr. Hamza, may I know the pain duration? Okay. If it is with defecation, okay. Have you noticed any bleeding along with that at the end of defecation? And how long it persists? Okay, Ms. Hamza, may I know the color of your stool? Okay. Have you noticed that the color is black or reddish? Okay. Fresh blood along with the stool. All right, Ms. Hamza, do you experience any tummy discomfort? How's your mood most of the day, Mr. Hamza? Okay. And have you experienced that when you have some urgent meeting, when urgent work, you have to use washroom frequently? You are worried? Okay. And how about your urine, Mr. Hamza? Have you noticed that you have to urinate frequently? Okay. May I know the last food you had? What you had? Okay. And may I know the liquid consumption? Okay. Mr. Hamza, have you explained that you feel lethargic, generalized weakness most of the day? Have you noticed any change in your voice? If constipation is followed by diarrhea, if you had any medication for it? All right, Mr. Hamza, have you noticed any weight change, weight loss or weight gain? Any back pain? Okay. All right, Mr. Hamza. To better understand, I need to ask you a few more questions, okay? And some personal questions. Is it okay? Thanks for your cooperation, Mr. Hamza. So, do you smoke? Do you drink alcohol? Do you have high blood pressure? If you are taking any medication for that, may I know the name of a medication? And do you have high blood sugar? Any neck-related problem? Any intestinal problem? Okay. If you feel numbness in your limbs? Okay, Mr. Hamza, what do you do for a living? Okay, and what's a kind of job you have to do there? If you have to be idle, you used to work. Okay. And do you do exercise. If you are married, Mr. Hamza, do you have a children? How's everything at home? How about your sleep pattern, Mr. Hamza? Okay. Right, Mr. Hamza, if there is any immediate family member suffering from intestinal condition, some symptoms you have. Okay. If you take any medication prescribed by doctor or over the counter. All right, Mr. Hamza, to better understand, I need to examine you. Is it okay with you? Thanks for your cooperation. Could you please come on the couch? And I'll sanitize my hands and let them dry. Mr. Hamza, can you please expose your abdomen and your nipples? And thanks for your cooperation. And then I'll look for any scar, deformity, any skin discoloration, any bulging, and then I'll check a pattern of breathing, and then I'll do palpation. Mr. Hamza, do you have any pain at particular site? If you feel any pain, let me know. Okay, I'll stop then. Okay, then I'll do a light palpation and then deep palpation for any organomegaly, and then I'll check bowel habits, bowel movements, and then I'll check bowel movements. I'll put a state on right-sided ileocecal junction, and then I'll listen bowel movements, and then I'll do fluid drill, and then I'll auscultate heart, and then I'll check palms and nails, pulse, and then I'll check left supraclavicular lymph node. Mr. Hamza, could you please shrug your shoulders up? And thank you. And then I'll ask patient to Mr. Hamza, can you please look down, look up, show me your tongue, tip of your tongue. Then I'll check neck from front, then back, and then I'll ask patient to swallow. And then at the end, I'll check shins. Mr. Hamza, I need to examine your I need to do a rectal examination. Okay, is it okay with you? If it is convenient for you. All right, Mr. Hamza, if you are undergoing an investigation, may I know the findings of it? Okay. Okay, thank you, Mr. Hamza. So, Mr. Hamza, the question you have, the question I have asked, and the history you have shared, and examination I have performed, and the report and the examination of your rectal examination, I came to the conclusion that you are having a condition what we call in a medical terminology, okay, is constipation with anal fissure, okay. But you need not to be worried, Mr. Hamza. I'm here to try best of my abilities to solve your problem. Is it okay with you? All right, Mr. Hamza. But let me ask if you undergone any investigation so far. Okay. Okay, Mr. Hamza. So I'll offer you non-pharmacological and pharmacological management. Okay. So I'll encourage you to follow some lifestyle changes like increase fluids intake. Okay, and take 8 to 10 glasses of water at least. Okay, per day. Okay, I'll encourage you to do exercise. Okay, for 30 minutes. Okay. And I encourage you to have a healthy diet, okay? I take fruits and vegetables, okay? And a high fiber diet, okay? And allow enough time for bowel movements, okay? And besides that, I'm offering sex part. It's actually you have to put lukewarm water, okay, which is tolerable for you, okay, in the tub, okay, and you have to sit in that water for 10 to 15 minutes, okay. And along with that, I'm offering some stool softeners, okay, that is spagol husk, okay. You have to take 2 tablespoons in 1 glass of lukewarm water or milk, okay, 2 times a day, okay. And along with it, I'm prescribing serum lactulose, okay. You have to take it 30 ml at night, okay. But if you develop diarrhea, then stop it, okay. If it is clear till now. And Mr. Hamza, is you are experiencing pain after defecation. So for that, I'm prescribing nitroglycerin ointment application. Okay, you have to apply it your anal area. Okay, and because pain can cause constipation as well, because of pain you have to withhold your stool, okay, so it will relieve your pain and spasm, okay. Is it clear till now? If there is anything else you want to discuss with me today, Mr. Hamza. Yes, Mr. Hamza, I want to see you after 1 week, okay, to review your progress, okay. And here is my contact details. You can contact me anytime, okay. But if you feel that there is no improvement, okay, then we'll arrange a routine referral to general surgeon, if it makes sense to you, Mr. Hamza. Okay, Mr. Hamza, here is a leaflet. It includes all the information regarding your condition. I hope it will be helpful for you. I wish you happy and healthy life. Bye-bye.